Ancient Egyptians considered the heart the seat of intellect and thought. They largely disregarded the brain's role in cognitive functions. Medical practices often involved invasive procedures. A common procedure was inserting rods into the nasal cavity for various conditions, irrespective of efficacy. Ancient Egyptians performed brain surgery using rudimentary tools. Bronze chisels were among the instruments employed in these procedures. Brain surgery was used to address various conditions, including headaches. The procedures also targeted conditions like sadness, showcasing a broad application. These practices reflect a limited understanding of the brain's function and the origins of ailments. Ancient Greeks theorized that the human body contained 4 humors. These humors were identified as blood, phlegm, yellow bile, and black bile. Illness was attributed to an imbalance among these 4 humors within the body. Treatments were designed to restore equilibrium, aiming to correct the humoral imbalance. Ancient Greek doctors commonly practiced bloodletting to correct perceived humor imbalances. Bloodletting involved draining excess blood from patients, often using leeches. The practice was rooted in the belief that removing blood would restore bodily balance. This method was employed to cure various diseases based on the humor imbalance theory. The bloodletting practice lacked a scientific basis and was later discredited. Roman military medicine was primarily focused on maintaining soldiers' combat readiness. Wound treatment often involved the use of wine as a basic antiseptic. Wine's alcohol content provided some level of disinfection for injuries. Pain management techniques were rudimentary and often brutal. Methods included biting down on a stick or receiving a blow to the head for anesthesia. Surgical procedures in ancient Rome were conducted by practitioners with limited anatomical understanding. Knowledge was often acquired through observation, particularly from gladiatorial contests. The surgical instruments used were rudimentary compared to modern tools. Surgical techniques were often characterized by their direct and forceful nature. The overall approach to surgery in ancient Rome lacked the sophistication of contemporary medical practices. In medieval Europe, disease causation was often misunderstood. Common theories attributed illness to bad air or the influence of evil spirits. One preventative measure involved carrying fragrant flowers to repel disease. Another practice was trepanation, drilling holes in the skull. Trepanation aimed to release malevolent entities believed to cause sickness. During the Black Death, people sought various means of protection. One common belief was that carrying flowers could ward off the plague. This practice stemmed from a misunderstanding of disease transmission. The true cause, bacteria spread by fleas, was unknown at the time. Thus, carrying flowers was an ineffective measure against the Black Death. Trepanation was a common medical procedure in medieval Europe. It involved drilling holes into the skull of a patient. The procedure was based on the belief that it could release evil spirits, causing illness. Trepanation was performed without anesthesia and carried significant risks for the patient. Medieval bloodletting involved the practice of cutting open veins to drain blood from patients. The blood was collected in a bowl, and the process was monitored by doctors. This practice was based on the belief that it would remove toxins and restore health. However, there was no scientific evidence to support the effectiveness of bloodletting. Dental care in medieval Europe was basic and underdeveloped. Oral hygiene primarily involved chewing on twigs. Praying for relief was a common response to toothaches. Tooth extractions were performed using pliers. Anesthesia was typically not used during these extractions. Tooth extraction in medieval Europe was a crude and often agonizing procedure. The primary tool used was a pair of pliers, employed to forcibly remove the tooth. Anesthesia was non-existent, leaving patients to endure the full pain of the extraction. The lack of sterile conditions led to a high risk of post-extraction infections. Overall, medieval tooth extractions were characterized by significant pain and potential health hazards. Medieval doctors often wore distinctive and peculiar attire. A common ensemble included full black robes designed for comprehensive coverage. Bird-like masks were also a signature component of their protective gear. These masks were filled with various herbs believed to ward off diseases. The overall appearance was often frightening, potentially instilling fear in patients. This attire was intended to protect doctors from bad air and disease. Ancient doctors often displayed strong confidence in their medical treatments. This confidence was present even when treatments lacked effectiveness or were potentially harmful. The doctor's confidence influenced patients' perceptions of the treatment. This, in turn, affected patients' compliance with the prescribed medical advice. Ancient doctors often based diagnoses on the concept of humor imbalances within the body. Illnesses were frequently attributed to disruptions in the equilibrium of these humors. Treatments commonly involved methods to restore this supposed balance. Bloodletting was a typical practice aimed at removing excess humors. Herbal remedies were also prescribed, reflecting the limited medical understanding of the time. Modern medical care has significantly advanced compared to ancient practices. Modern medicine emphasizes evidence-based practices. Scientific understanding is now crucial in healthcare. These advancements lead to more effective and reliable treatments.